So are we bringing on our online guests? Are we playing a song, by the way? I feel like
What's
I
Jeff's
want a
song?
little dance move.
Yeah, what's Jeff's song? I can't remember. What did he pick?
Okay,
We're
I
doing
might
a
have
little-
chose this one because I
Everyone
feel like
on your
everybody
feet.
needs a
Come
little
on.
country in their life.
Let's do a little country. What are some good country moves?
Well, I used to be a line dancer,
Oh, please.
but I think I kind of only did this.
Oh, okay, cool. I can do that.
And some
Yeah,
backward steps.
Yeah.
Anybody else? Do you have some line dancing moves?
Anybody? Front, back, side.
Some of the other stuff.
Oh my God, Andrew's got it. Andrew.
Oh,
Andrew,
Andrew.
look
Yes.
at Andrew. He
Yes.
can help us. A little forward, a little back, a little forward. Jeff's like, what is going on in that room? We're just
Hello,
having
Jeff.
fun, waiting for you to show.
Woo.
Big deep breath. Let's get ready for that next session. Thanks for participating, everybody.
Yeah.
Okay.
Okay, I'm going to get a little closer to you.
Sure.
Then we can see Jeff here.
Yes.
Jeff, how are you?
Welcome.
Good, thank you. I'm so sorry I can't be there in person, but I'm
Yes.
so excited to be here, at least virtually. So I'm great. How's everyone there?
Wonderful.
Fantastic.
We're a great crowd today. Yeah.
So I have a little intro for Jeff, even though it feels weird to say it because I feel like I've done this so many times now for you, Jeff. So Dr. Jeff Alfonsi, who is joining us virtually, is an engineer and physician specializing in internal medicine, obesity medicine, clinical, I always mess up this word, pharmacology,
No, you got it, girl.
and toxicology. He serves as the co-founder, chief product and medical officer of RxFood. Jeff currently practices at Trillium Health Partners, Cleveland Clinic Canada, and London Health Sciences Centre. Jeff is a leader in medical innovation and virtual care and has experience working closely with the senior leadership team to develop and scale innovative and virtual models of care throughout Ontario. He also has research experience in drug trials and evaluating medical technology. Jeff truly believes in the power of diet and lives by this in his daily life. So thank you for being part of the discussion, Jeff. I also wanted to say a little something about Sandra.
Oh, sure.
I mean, I feel like you're so popular and everybody knows this anyway. But you are a certified, in case you didn't know, you are a certified food addiction counselor and trailblazer in your field.
Oh, yeah.
And the founder of the Food Addiction Recovery Program. And you wrote a best-selling book, Never Enough, 3 Pillars of Food Addiction Recovery.
And I brought a bunch of books with me, so if anybody's interested, I'm happy to gift you a signed copy. Just come see me at the break.
Oh, what a special treat.
Yeah, of course.
Yes.
Happy to.
Wonderful. Okay, so thank you, Sandra and Jeff. I just have a couple of questions, and I would love for you to kind of riff on the topics that I'm going to put forward to you.
So we got to get Jeff on the big screen, because only we can see him.
Yeah.
We want to see Jeff.
Everybody wants to see
Yeah,
Jeff.
there you are.
Okay.
Okay, we got you up. All right.
Good
let's-
catch. Good catch.
Hi, everyone.
So, Jeff, tell us, what really inspired you to spend all of this time and really put yourself into the space, the world of obesity, weight management? What was your inspiration?
Yeah.
For sure. And, I'm going to tell the story. It actually came from patients, and I think that was how this started. So, I just in the intro, I'd done engineering, and one of my really good friends in engineering, she had lived through, and she'll share this, I could share this, but she had lived through an eating disorder for about a decade. And that included first year of engineering. And I don't know if anyone's done engineering or knows anyone, but that first year of engineering is not easy. And she was at inpatient care at times and still managed to get through one of the engineering. It's just a testament to how powerful she was and is, right? And just someone I really look up to. So one day she has been speaking with a friend of hers who was living with type 1 diabetes, and they both had their own reason to be thinking about food. She obviously had her past experiences, and this individual had type 1 diabetes from a young age and was always worried about the carbohydrate content in the food. And they were just talking about the ways that they were currently trying to understand food. And the two of them had said, there's got to be technology or better ways to do this because it's really hard and it's not working for us. And so they came to me because I think I was just someone that they knew, and I was in medical school at the time, and I'd done some apps, and they said, hey, what do you think of trying to solve this problem? And I thought that was a great idea because I had 2 hours of nutrition lectures in 9 years, and I had people asking me all the time and did not feel prepared for it either. And so that's how we started. We actually started initially in diabetes, and we went to the Hospital for Sick Kids where this individual with type 1 diabetes was being cared for. And we kind of worked with them over 3 years and met with a whole bunch of different people, patients, as well as the clinicians, and try to came up with this idea that I think there is a way to bring technology in to make a better idea of kind of understanding food. And the kind of the vision was, could we make it a bit, when we need it, can we make it a bit more like a diagnostic test, if we will, in terms of how do we understand the content, the quality of it, and not just focusing on certain kind of numbers like calories, of how do we go deeper into understanding to trending this. And that was the idea. And the second thing is, how do we make it as easy as possible for individuals that need to track this information. And so the idea that we came up with that was that was alone, it's just been a really great, I guess, start. And maybe that's what led me into learning and meeting people that were caring for people living with obesity. That got me to do my American boards in obesity medicine. It got me interested in lifestyle medicine. So it was just the people that I met through that journey was just really, it was really transformative to me. And it really became a really interesting problem. And like I said, I think I've been really grateful for those 2 patients that came to me, because I think it completely changed the way I practice and the way I'm going, and even just being here today, all because of that. So I think that was my inspiration, was initially just hearing patient stories and wanting to be able to find ways to try to solve it a bit differently.
Wow.
Yeah. That's so great.
It is so great. So maybe we'll save it for a little later for you to tell us about this really cool app that you've alluded to. So, we just had a talk about, kind of like how our mind functions around food. And I feel like, though, maybe we have an opportunity to dive a little deeper into cravings. And I know that that's something that the tool that you've alluded to really helps with as well. And maybe, Sandra, you could share with us, like, what is it that we're experiencing? What do these cravings feel like? What's the impact that it has on our lives?
Yeah, so I think Sasha, Dr. Sasha Hai brought up a really important point, that everybody in this room is intelligent, and you already know pretty much what to eat and what not to eat, and you already know movement's a great idea. So then it becomes the how. So whatever plan works for me, because everyone has to find an individual plan that works for them. It's ridiculous to believe that there would be one meal plan that would work for everybody in this room. We all have to consider our health needs, our physical activity needs, our cultural preferences. And once we find whatever meal plan works for us, then it becomes, how do I stick to it when I'm stressed, when I'm lonely, when I'm overwhelmed, if I'm going through a divorce, if there's a death of a loved one, when. And so the other complication to that of how do I stick to whatever plan works for me is cravings. Because cravings, when you've lived with obesity or are living at an elevated weight, cravings are overwhelming. They're immediate. They take us over like a flash, and they have us moving when we don't even know. I'll be lying on the couch, and all of a sudden I'm up like a zombie. What's in the fridge? I don't even know why I'm there. And so for a lot of us, how do we manage those cravings when we've already found the plan that works for us, that makes us feel vital and healthy, and then it's 8 o'clock at night, and I'm on the couch, and boom, I remember that my daughter has Easter chocolate left over. What do I do?
Yeah.
Over to Jeff.
What do we do, Jeff?
Yeah, for sure. And I mean, obviously this is very complicated, and when we think about craving, there's definitely genetic factors that are playing with that strength of that craving, and everybody will experience those cravings differently to different extents. But as Sandra said, they can be very powerful, and they're really rooted in kind of a core part of our brain and our survival, right? When you think about the idea behind cravings, these are in our subconscious part of the brain. So the brain that we can't necessarily control, that's maintaining a whole bunch of our core functions, right? And initially the idea was if I found a food that was really tasty and it was probably high in calories and energy, this was important for survival, and I was enhancing those neuro circuits in my brain to make sure that I remembered that food so I could get to that food for survival, right? And so you think about these are like core instincts of survival that are built in. And so when we get these cravings, they can be really hard to manage for the simple fact that they are not in our conscious part of our brain. What I mean by that is it's hard to be able to control them or modify them, right? And so to that point, you can have that powerful wave that comes up. And I don't think that there's a simple solution. I don't think there's a one-time solution. Even as Sandra says, that how you handle it with one day may not be the same way that you handle it the next day. And I think maybe the one point I'd say is to be kind to yourself about that these are biological, they are strong, they are something that is really hard to deal with, and you should not be hard on yourself for them or how you react to them. I think just thinking about that from a growth mindset, from a kindness mindset, I think is a really important first step. The other thing that I try to say is really try to identify where possible, is there trying to identify between physical hunger and emotional hunger. And so again, this could be an opportunity where could you pause and just reflect on, why do I want to eat? What am I feeling right now? Can I just take 2 minutes? And if it turns out that, I just actually ate 30 minutes ago, I'm probably not physically hungry. Maybe there's another thing. Why is this emotion coming up? And what can I do about it? And so I think just that, even that appreciation of the fact that this could, trying to identify between physical and emotional hunger, I always give people that's awesome. That's a first step. Even if you go and say, I can't do anything more beyond that, again, it's that idea of appreciating that awareness and that understanding, right? And I think those are really important. The other thing, and this kind of builds on a little bit what I heard Dr. Hai say about that 1% idea too, is there's a couple, and I kind of relate that to an author that wrote Atomic Habits. I was listening to a podcast about that author, and there's a couple of really interesting tips about these small votes or small things that you do that move you in the direction of where you want to get, and to celebrate those small steps. And again, even being aware that I have a craving, this is what it means, this is maybe why it is, all those are positive steps, that 1% step. And so I think those are really important. There's a couple interesting, maybe other areas I want to talk about that might be a way to approach a craving. And this comes from, I've been trying to learn more about culinary medicine, and I have a good colleague that's studying culinary medicine, and they've done some interesting kind of research or experiments more there that I thought would be interesting to share today. So culinary medicine it's a new branch of medicine. It's kind of a more of a certificate type training that people that in healthcare might do. And the idea is I want to learn some fundamental skills on how to cook, or a little bit like what a chef might, but how do I pull those healthy foods, those whole foods, and those different strategies in that I can make it easier and faster for me to prepare the foods that I want to. And I think it's a really powerful tool, and the idea is to hopefully be able to, as culinary medicine practitioners, share more and more of that with you and for learning. And one of the areas that I thought was really cool was this concept of flips, they call it. And so it's a dessert flip is what I'm going to talk about. And this came from some people kind of experimenting in the kitchen. And what they found was, you think about traditionally, if you get a dessert, it was the ice cream or the cake, and then they might put a few berries on as garnish. And so what they thought is, what if we modify this and say, what if we make it berries with a little bit of ice cream as garnish, or a little bit of cake as garnish? And they actually experimented with people, and the overall sensation was still pretty similar, which was the fascinating part. The experience of eating mostly berries with a bit of ice cream wasn't radically different than eating ice cream with one berry. And that, I think, is a really interesting experiment to think about. So one thing that I've told people is, have some frozen berries in there. And when you want to have some, you fill the bowl up with frozen berries, and you put a little bit of ice cream on, you make it look nice. If you want, you can put some mint on it, whatever. But the idea is that you can still get that experience of enjoying it, but you've just flipped what's in there. And so I thought that was a really interesting strategy, and something that I've shared with people, and at least some people have found it helpful, and you can kind of see what works for you. There's also an example that someone gave where they wanted chocolate, and so what they did was, again, they took frozen berries, they melted a tiny bit of chocolate, and they just sprinkled it on, like drizzled it onto the frozen berries, and they find it very enjoyable. And it kind of, you want that Easter chocolate, maybe take a little piece of it, you melt it, you pour it on, and you get that experience. And so I just thought that this, thinking from the way kind of creative chefs with a little bit of perspective on maximizing certain things like fruit, vegetables, berries where possible. I just thought that concept of a dessert flip was really innovative and something that I thought would be great too to consider. Another tip, and this one actually came from the author of the Atomic Habits books, but I thought was also a very great example was, when you bake cookies, you've got these like delicious cookies on a tray, and it's really hard not to eat more than you want, right? It's impossible. But what they said was it was such a great idea. They freeze them into little balls of individual cookies, and they put them in the fridge. And then when they want them, they take them out and they have to cook them, and they have to wait 10 minutes for it to be done. And you really enjoy this cookie and it's delicious. But if you want another one, you have to go back in and wait, and it gives you that time. And it's, again, just that small pause that lets you check in. And so, I think that these were just some really interesting kind of strategies that I thought was there. And maybe the last one, I know I'm talking about a lot, but there was someone talked about even making their own ice cream out of, frozen bananas and other things. And it just took the step that when you wanted, you had to actually blend that up, but you really enjoy it. So, these are things, again, they might be hard to do when you have a powerful craving. I want to acknowledge that. And I kind of come to that point about being kind and working along the trajectory. But some of these ideas of if you do still want to have it, can you flip it a little bit or just see what's that combination in there and experiment if you still get the enjoyment when you flip those combinations. It's something that I think is a really interesting concept. So maybe I'll stop there. Of course, if anyone wants to comment on that, happy to go further or hear your experiences on anything that you've tried before.
Well, I want to share, actually, you told me about 3 years ago, because I am a big advocate for anyone living in rural and remote locations and how do we eat healthy. And I put to you, like, what else could we do? What's another flip or something interesting? And you told me about using frozen green peas. So a lot of things that we cook, we can bulk up the food with frozen green peas. Whether it's a soup or a curry or just as a side dish. And usually the frozen vegetables don't really have any additives of any sort, really. They're just frozen right away. They don't need preservatives to stay fresh until they reach a remote location. So I do that a lot. And in fact, I told my Uber driver about that on the way here this morning because we were talking about curries. And he's like, I kind of need, my wife and I decided we should probably, cut out some of the curries, try to eat more vegetables. I'm like, well, put the green peas in your curry.
I love that. I work with a doctor out west, Dr. Michael Lyon, and he talks about the unapologetic pursuit of deliciousness, which I love. I love when I look at meal prep and cooking as an unapologetic pursuit of deliciousness, right? How inspiring is that? Because oftentimes we want to be pulled towards our behaviors as opposed to pushed. And when I'm inspired, that pulls me forward as opposed to should, I must, I have to, because that's not an inspiring way to live. And I want to feel excited and inspired about the food that I eat.
That's a great point, Sandra. And I challenge people to come up with their favorite meal that they make that they love, that they taste, they're so excited they want to tell everyone about. And that's really cool because you worked on that, you built it worked for you. You should be proud of that. It can be easy. It doesn't have to be complicated, but I think that idea of being proud of that and really trying to find those flavors that you like is so important. So I'm 100% with you there.
Mm-hmm. So Sandra, is there any particular strategy or approach that you take? Can we go back to you recalling that your daughter still has Easter chocolate in the house?
Well, my daughter's 13, so there is also the threat that if I touch that chocolate, the wrath of her. So that helps, definitely. But I think that we can also look at cravings as waves. And I go back to a spiritual teaching that I learned a long time ago, that nothing in nature is permanent, absolutely nothing. Everything arises slowly, and it peaks, and after its peak, it falls away and it loses its force. That's everything, including you and I. We all started with an idea in our parents' head, and then we trickled up, and we peaked, and maybe you haven't peaked yet, I hope I haven't, and then eventually we fall away. And a craving follows that same exact curve, right? It could be lying on the couch or watching, wouldn't it be nice? And I think there's some left over. And oh my gosh, it'll be so delicious. And a craving peaks. And when a craving peaks, it's actually uncomfortable, right? And it's often uncomfortable because you might be in that mental tug of war. Will I, won't I? Should I, shouldn't I? Maybe I'll just have a little, but I never have a little. I always eat the whole thing. Maybe it's okay tonight. Maybe I'll start the diet over tomorrow. And that mental tug of war. And the only thing that actually quells that mental tug of war is go eat it, right? Because then my brain will finally shut up. But the truth is, if I can withstand the peak, if I can ride over the peak, that is painful, there's no question, it is difficult, it will not maintain its force. A craving is not permanent. And if I'm willing to ride the wave, if I'm willing to ride maybe the pain of it, I'll come out on the other side. And riding the wave of a craving, I always say, the more you do it, the easier it gets. The more I do it, the less scared I am of that wave. And I think when we think about changing our relationship to food, we have to think about it like learning to play a new instrument. And this is an instrument that is so important to us that maybe we've been trying to learn our whole lives. And when you're trying to learn a new instrument, sometimes you hit those notes and it's beautiful and it feels so good and you're so proud of yourself. And the next day you pick up that instrument that you really want to play and you're going to suck so bad and it's going to sound terrible. But it doesn't mean you just throw away that dream. It doesn't mean, oh, I don't want to play that instrument anymore. We just keep practicing.
I love that. I heard you kind of describe that wave, and I think about that. Like, most times, like you said, Jeff, sometimes these cravings are, they like force you to action. And as you mentioned, you're actually making the movement before you're like, oh, this is a craving. You're already at the cupboard. You've already got the chocolate in your hands.
It's sort of like the waves of an ocean. Every once in a while you can manage it, but every once in a while, a tsunami.
Yeah.
Right?
Exactly.
Well, not every once in a while, but but a big
a
wave
lot of times.
that hits you over. Yeah.
Yeah, I feel like managing cravings is a big part of my day.
Yeah. I almost feel like that's the actual real work. Because this notion that there's a perfect diet out there that doesn't exist, this notion that it's willpower, we've already discussed that's not what it is. Willpower is just an exhaustible resource that you might use in a pinch, maybe to get you through a craving, but you certainly don't live on willpower. So what is it, right? I feel like I've really narrowed it down to it's managing urges and compulsions to eat for comfort, as Dr. Hai talked about, emotional comfort, or maybe it's a compulsion for some of us. Or maybe it is just those cravings. And listen, at the end of the day, we live in this world that is filled with cues. We have food cues 24/7. Billboards, radio, TV. Then we go to meetings, we go to offices, we go to parties, right? How many people have ever gone to a cocktail party? You're not hungry, but my God, the spread. Who's going to avoid that spread, right? So
it's tough.
Cravings
tough.
are really at the crux of it. Is my opinion.
Absolutely. So then, what do we do, Jeff? You talked about this tool? You hinted about this tool that you have.
Let's hear about it.
Let's hear about it.
For sure. Yeah. So, this was something that I just want to summarize some of the reasons why we wanted to create RxFood, and so. A lot of the things that we had heard when we were speaking with patients and certain healthcare providers was that, tracking food is onerous. It is hard. The data that comes back from some of these can be hard to interpret or anxiety provoking and number based, and that's not always helpful. You sometimes miss the big picture of terms of the food philosophy when you're just looking at the numbers, the macros. 1,000 calories can be 100 different types of ways you can get them, actually innumerable ways that you can get that. So what's the quality, the philosophy of that food? There's other people that are worried about the security of the data. Some apps that are free, who knows where they share your information. Studies have shown that some apps might share it with hundreds of different groups. And then how do you make sure that you get that data securely to a healthcare provider so that they can use that and make it in a way that's easy for the healthcare provider to be able to guide with? And so these were a lot of the concepts that we were trying to work with when we did kind of the design principles, if you will. And so the core of RxFood was we wanted to, again, make it easy to enter by being able to just take a picture of your food, or being able to dictate in, just describe it. So we wanted to make it very easy. And that was kind of the core of it. And then we wanted to make sure that we could kind of control the type of data that came back. And so by default, we actually send no nutritional data back, but with a healthcare provider, you can pick what you want to see or what goals that matter. And I think that was important. We can share some and some diet quality information back. We want to focus on, different kind of scores about diet quality. So what is the types of food you're having, so you can learn that if you want to. Again, that could be turned on or off, or it could be something that could be seen very easily with your healthcare provider, so that they can give you some tweaks and modifications. And that was the last thing, which was wanted to make sure that the suggestions that came out from the technology were built on what you were eating to begin with. And so we have some recipe tips that are, based on what you are eating, what foods you are eating, how do we kind of build up and enhance those foods, because we know they're already something you know how to use, you're purchasing, they fit in. How do we just augment or modify them a little bit if we need to, optimize the quality or meet your food philosophy? So that was a lot of what we tried to do with RxFood, and so it's something that a number of healthcare providers have and will share out with patients, and even some patients directly through some patient support programs can get access to it. And so that was really what RxFood is about, is trying to kind of just flip it around. And also, maybe the last thing I'll say is let you do intermittent periods of tracking. So I just want to track for 3 days, much like you might get if everyone's worn a heart monitor before, you wear that for 3 days and a report comes out. You want to say, if you just want to track for 3 days and stop, just do that. We're going to look at this information. We know 3 days isn't perfect. We're still going to learn maybe some little things from it. Take a break, and when you're ready, let's do it again and compare. So again, thinking about how do we look at nutrition. And I think that's important because, to me, although nutrition is not going to be the core way by which we lose weight, no way, but it is still critically important to our health, right? It can impact the inflammation in our body. It may impact our microbiome. It may impact our mood. It may impact our heart disease, our glucose levels, right? So all of these things are why I think it's really important to still be able to look at it, but we're looking in a way, how do we optimize it for total health and for prevention and all those key elements? And how do we do it in a way that's as easy as possible and hopefully as enjoyable as possible for everybody involved? And so that's what we've been continuing to try to do with the RxFood. And maybe I'll just say one other thing, because this came up at the conference I'm at, and I thought it was really interesting. And there's no scientific evidence around this, but it was a discussion that people wanted to talk about doing. But because we do a lot of work in diabetes, we also connect to a continuous glucose monitor, which measures your glucose level every few minutes. And one of the guys that was talking, and a pretty big player in the US, does a very high credential, was wondering if monitoring glucose levels and relating that to food noise and craving, that there might be some correlation in some cases. And there could be reasons for, if your glucose goes really high and really low, you may have, certain cravings out of it. So again, that's a bit of just the future, that maybe there'll be more information that might be some reasons why you feel that way. It's not going to solve everything at all, but I'm just sharing that, this was some of the interesting things that we were talking about this weekend. So that was maybe the last point I'll say.
So much richness in what you shared there. I love the idea of bringing food journaling into, the 21st century, because I don't know if anybody can relate, but whenever I was asked to do a food journal, I was super keen as long as I ate perfectly. And then as soon as things went sideways, you know what I did with that food journal? I just chucked it, right? Because I found it like, oh, this is so shaming. I got, oh my God, how much did I eat? So I'm so happy that it's pictures. And I remember learning I attend a couple of obesity conferences a year to keep, abreast of the new science. And I attended a session that talked about having people take a picture of their food, and that it was a moment of mindfulness. That in fact, many of us don't take time to even look at our food. So there was something about preparing the plate, getting the camera all in the right angle to take a picture, that it was a pause. And it gave your brain a chance to understand, oh, I'm about to eat all this food. Look at it, it's gorgeous, it's abundant, it's going to be delicious. And that's actually a mindful minute that I try, or not a minute, even 20 seconds that I try to do, is like almost eat my meal with my eyes first, like really take a look. So I love that notion of it. And also that notion that not all calories are created equal. That, did you know an avocado and a Big Mac have similar amount of calories? Well, a Big Mac does a lot of metabolic damage, and an avocado is a beautiful natural thing. So how can all calories be created equal? So this idea of having a picture and then getting some biofeedback on it is great. So yeah, really exciting times. Thanks for creating that app for us, Jeff.
Yeah, and so just a future consideration, so I will make a confession. I do use ChatGPT to help me manage the foods that I eat with medications
Wow.
and some supplements that I might be taking.
Nice.
So I'm like, okay, tell me when I should be taking these medications or these supplements, like what are foods that I maybe should avoid because of a particular health condition. So I don't know, like, are you using AI? Are you also going to be able to eventually plug in, like, what are the medications I'm taking versus what kind of food should I be eating to supplement, to support that kind of health condition? Anything like that coming?
Yeah, that's a great point. So the AI is involved in kind of the recognition of the image and also in that food suggestion component. So this is something when you're kind of suggesting some recipes or ideas. So right now it's not, this is my supplements, here's my medications, but it's as a whole, if the goal is to increase protein or to follow a certain diet philosophy, like the Mediterranean diet philosophy, based on what I'm doing, AI is trying to figure out what patterns or what foods or what ideas or recipes are the ones that are going to fit best for you based on what you've tracked. And so that's how I think it's a very similar bit. We're hoping to be able to do more and more around that to personalize that a bit more. And I think that is really the future, as you said, being able to know, when should I eat this or when should I take the medications, and it kind of, not to go too off track, but there's a really interesting field on chrononutrition and the fact that our genes and enzymes are actually fluctuate throughout the day, and how we metabolize and process foods are different. And the core takeaway is we probably process food better earlier in the day in general than later in the day. But that's just an interesting example about how you may personalize further things, or how medications and supplements may be best to be spread apart from certain foods or the time of day. So, that's probably a little more advanced, and I think that's like the cherry on top to get there. I think there's a lot of the fundamental stuff to start with, but I think eventually those could be really cool ways that personalize it, make it feel more for you specific plan, and it might be interesting for sure.
So I think we have time for a couple of questions. Does anybody in the room have some questions? How are things?
Right over there.
Oh, all right.
Wonderful.
Yeah.
Hi.
I wanted to ask questions of Dr. Hyde too before, but we ran out of time there. So it's kind of general comments and questions. I discovered Obesity Matters about a year and a half ago. I think I sort of showed up at one of your first person events since after COVID. And I met you wonderful people, and I kind of came in as I was bitter and angry about how I've been let down over the years, constant. I've been living in a large body, as you say, my entire life as well. So then it was really meaningful, came to the summit last year, and I'm like, we all know what we should be doing. Yes. We all know, right? Yeah. We all know what we should be doing. We know what we should be eating. We know what we should.
Yeah.
And then now a year later, Pretty messaged me a couple of weeks ago, and she said, are you coming? I'm like, absolutely, I'm coming. So here I am a year later, and I realize how much more I've learned since last year, which is really interesting to me. And everyone's talking about cravings, so I really want to address the craving issue a little bit here. But the culinary medicine, I was looking it up online. I'm like, what is this? Oh my gosh. Because I just heard something about social medicine as well, which is another thing I'm digging into. Yeah. I'm a nurse, just saying that, and I have I'm involved in clinical studies, I'm involved in a bunch of other things, so I kind of have this healthcare lens on all the time. Myself suffering with I'm the poster child for obesity. I've just, you can see my trajectory, high blood pressure, all these sort of things, and really sort of taking a mindful stand about my life this last year. So I joined Noom, which is dealing with the psychology of eating, because I'm like, you can tell me what to eat, no problem, but doing the work, no one tackles the mind. So I'm really appreciative of these little tips and tricks, kind of going, wow, I've actually been doing that this year. I don't have all or nothing mentality anymore. I go out for that little walk because I know I'm going to feel better. Like all those little things, I've really put a lot of them into practice. And you're right, and you talked about the win. The win is weight stability. That is the win, and they missed the win. And I used to sit there and look and go, why is the scale not moving? I'm like, it's a non-scale victory. And she's been a great support, my friend here. She's been a great support for that too. So I just think it's just, if we don't start somewhere, where are we ever going to start, right? It's those little things, mindful. And the one thing you did mention, Dr. Hyde, the compassionate pause.
Yeah.
Oh, how meaningful is that? Treat ourselves with such respect. We deserve this.
Yeah.
Like, and putting those just like simple mind shifts in there. And the culinary medicine, I mean, I just blended strawberries and bananas the other night. Like, hey, I got a sorbet in the fridge and I loved it.
Yeah.
And adding yogurt instead of sour cream. I love cooking shows. I love to cook. I see these steaks. Gordon Ramsay puts a pound of butter. No wonder they taste good. I made my own filet the other night. I used 3 tablespoons of butter, and it was just as good.
Exactly.
Well, I mean, I haven't had his steak, so who knows? But it was just as good. So it's these little things. We can beat ourselves up, which we do every single day. But I just have to have that compassion. And I think that's where it shifted for me this year, is I'm not coming in angry anymore. This is the body I've been given. I'm choosing to live the life the way I want to. And I'm just trying to give myself that compassion. So, like, after my little passion speech, I want to address the question about cravings. So I've been trying to identify psychological hunger from the actual physical hunger. And you know, they say if you're physically hungry, you'll eat anything, right? You'll eat anything just to get that sustainment. And I tend to disagree. And it's where I kind of struggle. Sure, in the middle of the day, it's kind of like, I want chocolate. That's a craving, right? Because you know, it's very specific. I need chocolate right now. Thankfully, I don't have a sweet tooth. But when I have cravings, I crave protein. Like, I go for the proteins all the time. So I struggle, because when I'm physically hungry, I sit there going, oh, there's an apple. I'm like, nope, get me a chicken, a whole chicken. So how can you actually tell the difference between a physical hunger and a psychological hunger when you're craving like things that are actually good for you? I would eat a chicken breast right now. Like, it doesn't have to be fried. It doesn't have to be unhealthy. But if you give me those rotisserie chickens, I'll plow through it. But if you give me a cookie, I'll have a bite and go, thanks. So that's my question.
Yeah.
That is a really good question.
Yeah.
I want to know the answer to that too, Jeff.
Take it over, Jeff.
Good. But first of all, thank you for the comment and sharing all of that. I think that was really powerful. And I wanted to thank you for that and the year that you said how much you've learned. And it comes to that point that those 1% small steps, they add up. And it's only when you look back and you see them. So thank you again. And I think I'm very happy to hear where you're at and where you'll be at next year. Maybe, you know, my best answer is I think it's probably impossible with 100% certainty to know if it's a true craving or physical hunger. So I want to start with that. And again, coming back, there's maybe some signals that might say one more than the other, but you know, it's hard to know for certainty. And I don't think you have to be too perfect on that point. I think the fact you're pausing and asking that is the big question. You know, what I kind of say is one of the things to say, when is the last time you ate and how, and what did you eat? That's I find one of the most helpful questions. And then, so if it was, I ate my lunch, it was a balanced meal and it was 30 minutes ago, it's probably less likely that I'm physically hungry if it's a usual. And if it's like, I didn't have a lot of time, I had like a very quick banana, it was 4 hours ago. And like that, I find that to be a big help in determining it. And then I might also weigh in physical activity. So like, was I very active as well? In which case, even if I ate my regular meal and I did a exercise I don't normally do or more exercise, I might just need a bit more. So I find those to be some helpful tips around that. And then also just pausing to the fact, say, what am I feeling right now? Am I feeling stressed? And what is my mood? What is going on right now? And sometimes if you say, you know what, there actually is a lot going on, that might tip you more towards the emotional side. So I find those as some easy practical tools. But I also want to say at the end of the day, if you don't know fully, at least you tried your best, you take your guess, and then you're going to, so I think that's kind of how I would approach it.
Thank you.
Yeah, thank you. I think if I know that I just had chocolate 20 minutes ago, it's probably still a craving.
Yeah.
But it is really complicated, and thank you for saying that it is not easy to navigate, that it's really tough. We'll take one more question, and then we'll go to break.
So my question is about exercising. I exercise, and I don't know how many calories I might be burning, but what I'm finding is that after exercising, I eat a lot more. And I think it's imbalance there, and I don't know how to balance that.
Yeah.
That's a tough one.
It's a really good question. It's something that a lot of people talk about, right? You know, your combination of recovery, whether it be that your body wants to eat and your body needs to eat certain things, but after exercise, definitely people can eat more or than they want or enough. Like it is a really hard kind of approach to it. What I've done a couple suggestions here, and again, I think you individualize it as best you can, but sometimes having a pre-workout snack can help. So like a small mix of like some carbs and protein, go through the workout. Maybe you're a little less hungry after that workout. And so I find some people find that helpful. Not everyone does. This is, again, it comes down to everyone's individual patterns. The other thing is to try to be a bit more like maybe a bit more firm on, okay, I'm doing this workout, I'm going to have this recovery snack after, right? And try to say this is the protein in it, and I know what it is in advance. I think when you get in where you might have more challenges if you don't plan that, and then when I know I'm going to be hungry after my workout, I'm just going to take what's around, and I might feel that I eat a bit faster because I just worked out, or I'm trying to go somewhere, or I think and I find that those might be some of the things that set up to have a bit more. So sometimes I think just whether you have a few minutes to be thinking a pre-workout snack, if that helps. If not, having a bit more planning of that post-workout snack, or just trying to be a bit more slowly and mindful when you are eating in that recovery period. Those have been some things, as well as staying hydrated is the other thing I remind people of, because, with the exercise, you're going to, so making sure you get adequate water, and that might also help. So again, it's tough, and those are the general rules that I work with. And then, if you find it's a major problem, maybe you could, cease them to work through the specific plan around it. But that's just some of the general tips that I would suggest. But it's tough too.
Thank you. Well, I think we're
out
out
of
of time.
time.
Thank you so much, Jeff, for joining us virtually. Really appreciate your insights and your thoughts, and really excited about this app and also what it's going to do in the future. So thank you very much. Thank you, Sandra.
Yeah.
And we are officially going to have a break.
Yes, we need one.
So I think there's some coffee, tea, and whatnot in the hallway. Washrooms, again, are down in this direction. And we should be back shortly after 11. I'll just give you a little heads up when we all want to come back here and get seated again.
Thank you.
Okay.